Hi everybody. You all seem to like my live chats, and so I figured I would hop on and say hello. I am hoping that Facebook cooperates today and allows me to see questions and comments. If not, I'm just going to kind of be rambling here. I hope you're all well. I just got back from the gym, and it was my first time going to the gym in a really long time. So I am afraid that I'm going to be paying for it tomorrow, but we will see. I just did the elliptical, the bike, and some of the weight machines with my mom. And, again, I'm hoping that I don't pay for it too much. We are having some crazy weather here. I'm parked in my car. I figured I would do a little chat while in between meetings. And yeah, you can see the gray skies. Can you see that? I don't know. Yeah, it's pretty gray and gross here in Pittsburgh. Yesterday was in the 70s and sunny, and today it's kind of like really weird because, as you can tell now, the sun is popping out, but it's also cloudy. The weather can't make up its mind. It was like 70 and sunny yesterday, and tomorrow it's supposed to snow, like legit snow, and then, Monday it's supposed to be 78 degrees and sunny, which I'm not complaining about that. That's like ideal weather for me. But these constant fluctuations in the temperature and the humidity and the precipitation and like what the weather is, that is no good for my body. My body does not like it. It does not tolerate it. It's not an ideal climate for rheumatoid arthritis, osteoarthritis, migraines, or allergies, and I have all of the above. So yeah, it's always kind of a fun little experience when the seasons transition. This past year has been really difficult weather-wise, so even when the seasons aren't transitioning, it's been rough. I mean, we had a really mild winter, which you would think is a good thing, but it's only a good thing if it consistently stays really mild. And with us, it was like one day is 30, and then one day is 60, and then it's 20, and then it's 65. I mean, those temperature changes are really tough on my body, and I'm sure that a lot of you can relate. I see that some of you are on the chat right now, but I'm not really sure if there are any comments or questions. If there are, I'm not seeing those. I'm just seeing people joining in. So welcome to all you that are on today, and glad to have you. I really don't have a set topic for today. Sorry, my headband is kind of killing me at this point. That's what happens when you live with chronic migraines. You find that really weird things trigger headaches, and having my hair up in a headband for too long, oddly enough, is one of those things. So anyway, I'm not sure if I'm getting your comments, so I will just talk for a little bit. I wanted to kind of give an update just about some of the projects that I'm working on. The autoimmune registry is looking for board members, so if you or anyone you know would be interested in being a board member, we're looking for people that have fundraising experience, and preferably people that have a personal connection to autoimmune disease, or, any kind of experience with it or knowledge of it. But that's not a necessity. If you're a person that's just passionate about, doing good and being involved in a good cause, then you might want to join our board. We really need help fundraising. So if you would like to be a board member, or you know someone who would, please get in touch with me and let me know. We're also always looking for volunteers and people to help spread the word and kind of be advocates for the organization. So if you fit the bill, just let me know. We'd be happy to welcome you on board. And if you can't volunteer or you can't be a board member, maybe you can just do me a favor by going to autoimmuneregistry.org and filling out the survey. As always, I tend to plug it a lot, but it's part of my job as a patient engagement officer. But anyway, the survey is free, it's safe, it's simple, it's secure, it's easy, it's quick. So just get on autoimmuneregistry.org and take a second to fill out the survey. It is mostly for people that live with one or more autoimmune conditions, but we also ask some questions that could possibly pertain to caregivers of people that live with autoimmune diseases. So if you would like any more information about the Autoimmune Registry and what we do and what our mission is, please reach out to me. We are a 501c3 certified nonprofit organization. We are always looking for donations and volunteers and board members and people to just participate in the survey. So so please check that out. What else? Well, last night in the chat I talked about a new program I'm doing, which is the Optavia 30 and Take Shape for Life program. It's a diet and exercise and nutrition program that I'm on. I'm doing that coinciding with the Tone It Up bikini series for 2017. My personal goals are not necessarily to wear a bikini, because I don't think that's happening. Although I did get a really cute new Michael Kors one piece yesterday and a cute Speedo one piece the day before. But I don't think I'll be wearing a bikini, but that's not my goal. My goal is to just get stronger, get more fit and more trim and toned, so that I am healthy going into my knee replacement surgery. I'm trying to be realistic about my goals. I'm not going to look like a Victoria's Secret model or look like Karina and Katrina, who are the Tone It Up girls. But I can try to strive for my personal best, given all of my physical limitations and mobility and pain issues. So that's what I'm going to try to do, is stay on program and kind of do my best with that. I would like to have more energy. That would be ideal. I would like to reduce inflammation. That would be ideal. And if I feel okay in my bathing suit this summer, then that's awesome. But for me, it's not just about swimwear. It's about my overall health and wellness. So I will keep you guys posted on the Optavia program and my Tone It Up journey. You can also follow that on Instagram. My Instagram username isn't Arthritis Ashley. It's actually AMB Shuck. So that's AMBSHUCK. It's kind of my personal Instagram. I also do some of the Arthritis Ashley stuff on there, but it's not just the chronic illness and patient advocacy stuff. It's kind of everything. It's my pets and my outfits and my fashion choices and funny memes and personal pictures from, spending time with friends and family and traveling. And yeah, it is some of the health and wellness and patient advocacy stuff, but it's a little more than that too. Sometimes a little self-promotion for my books, which is never a bad thing, because hey, when you're self-employed and you're your own boss, you have to do all the self-promotion that you can, even if it annoys people. That's something that I've learned. So yeah, I just wanted to give you guys a little update on all of that. I wish I could see your comments. I cannot, though. I don't even know if anyone's leaving comments. I literally have no idea why this keeps happening. I used to be able to see questions and comments on the Facebook Live chats, and now I don't see them. I just see that people are on, and it sucks because it's taking away from the interactive, engaging component of this. And so I do apologize. I'm not ignoring you if you did say anything. I'm just not seeing it. So yeah, something else I wanted to mention. I posted a link last night and this morning to a recent healthline.com article that I was quoted in. It is about RA necessities, things that you can't live without in dealing with rheumatoid arthritis. And so I'm quoted in that, along with a lot of really awesome RA patients and advocates. if you want to check that out, it's on healthline.com. And I have a new Healthline article coming out this weekend about how wearing pedometers and fitness trackers can be beneficial for people with RA. So if you are a rheumatoid arthritis patient, you might want to check that out. I think my article goes live this Saturday. I could be wrong. It might be next weekend that it goes live, but I'm pretty sure it goes up this weekend. So I'll keep you all posted on that. It might be next week. I'm not sure. I'll let you know. Yeah, nothing else is really new here, especially since I did a live chat last night. But I do have a quick little anecdote about how sometimes health problems might be blessings in disguise. To avoid going into too much detail, I was having severe reactions to my biologic infusions, my last biologic infusions, which were Remicade, a TNF inhibitor, also called an anti-TNF drug. I had some really scary issues with it, allergic type reactions and disturbances to my autonomic nervous system. So my blood pressure and my heart rate were skyrocketing, sometimes into dangerous levels. And my temperature was fluctuating. I would get really lightheaded and really short of breath. I had difficulty breathing, and my small airways were spasming. It was very scary, and this went on for a couple months actually, and they were pretty convinced I had a form of neuroendocrine tumor called carcinoid syndrome. Very convinced actually. And through the testing for that, they found a polyp that was not malignant, but the type that it was, if it hadn't been discovered, could have grown and turned into cancer. So my doctor's office sent a note today saying all the pathology was normal, and that it was really good though that they found it, because if it hadn't been removed, it could have turned malignant. So I was like, holy crap. But then I thought about it, and I'm like, maybe all that stuff I went through with the Remicade and the bad scary reactions to the Remicade infusions was a blessing in disguise, because if they weren't looking for a carcinoid tumor, they wouldn't have found this other thing, and I may not have had the test to find it for God knows how many years, and by that point it could have progressed. So I am in the clear, and I don't need to have any types of testing like that done for another 5 years. So thank God for that, and that is just an example of something that was a really scary, awful, uncomfortable, frightening experience that turned out to be something good, because my carcinoid tests were negative. I don't have that. And this benign tumor was removed, but it was discovered that it was the type of tumor that could have turned cancerous. So I don't know if that would have been taken out of my body had I not gone through the carcinoid scare and all the issues with my Remicade infusion. So I do think sometimes, as crazy as it sounds, things do happen for a reason. So, I always talk about staying positive and finding the silver lining, and for me, that's a prime example of it. Staying positive does not mean that everything is perfect or that you're being fake and pretending everything is perfect, but it means that you're handling those situations that life throws at you well, and that you are trying to find the positive in every situation. And so I think that is an example of that. Right now, I still don't know what biologic I'm going to go on next, because of all these reactions that I've been having, and also some issues with my insurance. See, I'm 33 years old, but technically I was diagnosed with juvenile idiopathic arthritis because I got diagnosed with my RA as a kid. And so the insurance company looks at it that JIA or JRA is my primary diagnosis, not adult onset RA. And some of the biologic drugs are actually only approved for adult onset RA. And so it's a big fight with the insurance companies to try to get other ones approved. So right now I'm in between RA meds. I'm going to try to go back on Imuran, although I'm kind of scared of that. But I am going to try Imuran along with the Celebrex. And then after my knee replacement in July, I probably will try either Actemra or Xeljanz. So fingers crossed. I am trying to get healthy one day at a time and just continually cross all this stuff off my list. The past few weeks have been tough. I had a sinus infection, ear infection, strep throat, and the stomach flu, all within a matter of a couple of weeks. And I've had a couple RA flares and migraines thrown in there, so things have been pretty hard. I'm just proud of myself for actually working out a little bit this week and kind of getting back into the action of, going to the gym and everything, because I think that when it comes to exercise and nutrition and health, that forming a habit is really, really crucial to getting on track. And for me, it's hard for me to get motivated when I get out of the habit of doing something. And so I'm really happy to be back on the upswing and trying to get back into a healthy habit as far as a low carb, high protein diet, and trying to move a little bit each day. I'm not unrealistic. My husband is an awesome personal trainer, kettlebell instructor. He does all the crazy obstacle courses and everything like that, high intensity interval training. I am not unrealistic enough to think that I am overnight going to be able to go back to the kettlebell gym and do all these really crazy workouts. So for me, it's baby steps, and even just getting back to LA Fitness and doing the elliptical and the bike and some weights. And I'm going to start water aerobics again, and go bike riding on Monday. That stuff it's baby steps, but it all adds up to good forward progress. And so if you're discouraged from whatever illness you're battling or whatever demons you're battling, just try to remember that everything is about progress. It doesn't matter how slowly you're going as long as you are progressing forward. And so I need to be reminded of that all the time, because you can ask pretty much anyone that knows me. I am very, very, very hard on myself. I'm very insecure about my appearance. I'm very insecure about my physical ability or a lack thereof. I have a love-hate relationship with my body. It's usually more of a hate relationship, because I feel like my body is often the enemy, because it is always turning against me. So it's hard to love your body when you feel like that all the time. So those are things all things that I'm working on. I'm trying to not be such a perfectionist. I'm trying to not be so hard on myself, and I'm trying to practice the same empathy and compassion towards myself that I grant other people. So at the risk of sounding preachy, that would be my advice that I would give, other patients dealing with chronic pain and chronic illness. So yeah, that's all I really have for today. I would love to respond live to your questions and comments, but of course, Facebook is not cooperating and I am not able to see them live. So I'm going to sign off here, and I will go through if there are any comments or questions. Again, I don't know if there are, but if there are, I will go through and answer them. Don't forget about the giveaway. I am running a giveaway until April 11th. So you have until April 11th to leave a comment on one of my videos, my Facebook Live videos. They're all up in the video section. Leave a comment and tell me what you think April the giraffe's new baby, if it's ever born, what its name should be. And I will randomly select a winner, or up to 10 winners, I should say, to win sample size packets of the Deep Blue Rub topical pain relief ointment. It's essential oil based. I sell it. It's by doTERRA. It's awesome. So yeah, again, go to one of my recent Facebook Live videos from this week. It has to be one of the videos from this week, and just leave a comment telling me what you think April the giraffe should name her baby. Again, assuming that she ever has it, because it's been a long time coming. I am not picking my favorite name. I am just randomly selecting up to 10 entrants to each win a sample size packet of doTERRA Deep Blue Rub. And stay tuned for other giveaways after Easter for a chance to win one of my books. P.S. Before I sign off, I would love to ask if you have read any of my 3 books, which are called Sick Idiot, To Exist and Chronically Positive, if you've read any of my 3 books, please go on Amazon and or Goodreads and leave a review. It would really be really helpful to me. I'd really appreciate it. And please feel free to recommend my books to your friends as well. Thank you so much for tuning in. I've got to go. I have a meeting coming up. Don't forget to check out the Autoimmune Registry and Healthline, and leave a comment about April the giraffe in order to be entered in the giveaway. Okay? I hope you all have a healthy and relatively pain-free day. I'm sending you all good vibes, love, and light. Take care, and thanks again for joining me. Bye-bye.